Good morning, Lisa. I understand that you've been recently diagnosed with asthma and have a few questions that you would like to explore in regards to your condition. I'd like to go through some of the common causes of asthma and discuss with you any questions that you may have in regards to any treatments or concerns. Asthma is actually very common with Australians, with over 2 million Australians being affected by asthma. So 1 in 10 adults and 1 in 9 children do have asthma as well. It affects people of all ages and can be managed with effective treatment through your general practitioner. Asthma is a disorder to the airways of your lungs. What happens is they contract too often and too easily, sometimes just by themselves or in a response to something in your environment, or if you're just doing something physically strenuous. What happens when your airways contract is that they get irritated and inflamed very quickly, and they increase mucus secretion, which is very similar to when you have a cold and all your bodily fluids increase as well. Inflammation of the airway can make it feel like you can't breathe very well and can obstruct your airflow. There can be many symptoms of an asthma episode or asthma attack. Due to when your airway narrows, you can feel any and all of the following. So difficulty with breathing, gasping for breath, not feeling like you can get enough air. You might be unable to speak properly or speak a full sentence in one breath. Coughing and wheezing is also very common. You might also feel like the skin between your ribs or the base of your neck is being tugged. You could feel confused, exhausted, or distressed. It's very important that if you are having an asthma attack or feeling an asthma attack coming on, to seek treatment and medical help straight away. Because of the lack of oxygen, this can cause unconsciousness. Asthma can result from both genetic and environmental influences, so if anyone in your family previously has had asthma prior to yourself, it can be hereditary, or it can just be the luck of a draw. It is interesting that if in your family there has been cases of asthma before and it is hereditary, more often than not patients have reported that they are also allergic to antigens, so your common hay fever and that sort of thing. Myself, I'm allergic to anything with fur. There has been research conducted into possible gene and environmental factors. Although the exact cause for asthma hasn't yet been determined, research into asthma has discovered that there is a link between the rise in asthma and the change in diet. So with a decreased intake of fruit, fresh fruit, vegetables, potatoes, meat, fish and milk. So it is, as always, important to try and lead a healthy lifestyle. Treatments and the different types of therapies for asthma have improved over the years. It is thought that inhaled steroids are one of the better treatment options available, but there is a multitude of different treatments out there. So through discussion with your general practitioner, you'll find the best treatment and therapy course available to you. There are many treatment options available for asthma, like I said, so in the form of inhalers, relievers and steroids. There also is other medication, but your doctor will discuss this with you. As I'm sure this is very confusing at the start, I have got some handouts here to be given to you. These do have some links on how to use things like puffers and inhalers, also your general asthma care, asthma first aid, and different questions to ask your doctor. With the asthma first aid, it's information for yourself and for your family. So if you are experiencing an asthma attack or asthma emergency, there is steps on there on what to do and when to seek medical treatment and help. There also is an asthma action plan, which is very similar to the asthma first aid, but it has different steps for different types of asthma attacks and what to do in each type. So you discuss this with your doctor and then fill it out relevant to you, and then you will know what to do in what situation. Some of the questions that you may want to ask or tell your doctor include as much about your asthma as you can. If you're coughing, wheezing, breathless during the day or night, if you struggle to keep up with any normal activities, anything that seems to trigger or make your asthma worse, how often you take any current medication that you are on, and that you do wish to have a written asthma plan. With a healthy lifestyle and appropriate exercise and management from your general practitioner, your condition can be managed and you can have a healthy, relaxing lifestyle. More information and advice in regards to each treatment and the management of your asthma can be found online and also through your general practitioner.